So, Dr. Bisanga, can a patient with retrograde alopecia get a hair transplant, and what are his limitations if they can?
Yeah, for a patient with retrograde alopecia can have hair transplant, but it need also to be realistic, because retrograde alopecia will amputate a good chunk of your donor, because most of the time when you have retrograde alopecia, let's say at 26, 27, 10 years down the line, your donor will shrink. So
Yeah.
you shrink, your donor will shrink, and that means most of the hair taken around the retrograde alopecia, you may lose them. So we can take them, but then in the future you may lose them. So you really have to explain to the patient the limitation, and settle maybe for a higher hairline and a more reasonable type of sometime you have to make a choice between the front and the crown, and to forsake the crown, because most patients want to restore everything, and sometimes it's just not possible.
Yeah, and I think that's it. That's one of the key things that separates ordinary clinics from fantastic clinics, is really educating patients on what's realistic, because that's ultimately what's going to make the patient happy, right? You can execute a hair transplant perfectly, but if the patient just didn't have realistic expectations going into it, they're not going to be happy. And
exactly.
So that's super key.
Thank you so much for watching our videos, and for more great content, don't forget to hit that subscribe button, and also go to www.bhrclinic.com and start your journey for a free assessment with Dr. Bisanga. Thanks ever so much. Let's get started together, and look forward to seeing you soon.